The clinicians ourselves, we're face to face with the patients, and so, they are telling us their symptoms, their challenges, what's going on in their day-to-day life. And so as we were listening, we're thinking who in our team could help them with each of those symptoms. And we're very lucky at the Mellon Center Cleveland Clinic, we have always a comprehensive approach with the patient in the center and all of us, supporting them. So occupational therapy, physical therapy, psychology, speech therapist, depending on what's going on with the patient. And even many would say these days, as soon as they're diagnosed, to connect them to a comprehensive care of support. The pharmaceutical products are so important, but so is all the steps that we take throughout our day and the lifestyle practices we have throughout our day. So our exercise, our sleep, our nutrition, our mental health practices, they're vital. And that's why, from the beginning, the Mellon Center always has been a comprehensive center with the patient in the center, everybody around them, supporting them. It's vital. It's not optional. It's vital. You always need to have a team of support around you when you live with MS. So we talked about on our presentation, we talked about a patient we called Jordan. She worked at Amazon. She was a young mom. She had a 6-year-old daughter. And she was having trouble because she was tripping at work, and she was having trouble cognitively because she was stressed about her new diagnosis, and she was dragging her foot a little bit. So she ended up working with our occupational therapist for energy conservation. They have, a trick or a story. They say you wake up with 100 pennies and you only have 100 pennies through the day. How are you going to use them through your day? So she had a 6-year-old daughter. She didn't want to, at the end of the day, not have any energy left for her daughter. So our occupational therapist helped her to pace her day and to change things, even how you reach for things throughout the day. Our amazing occupational therapist was teaching her those kind of things, because you can waste or use up your energy in ways that aren't important to you. So you think of the priorities. And then our physical therapist helped her learn, she needed a brace for a little bit for her left ankle, so she wasn't dragging it so much. And so she felt safer at work, and she had held back from going to social events because she felt like her thinking wasn't as quick, and she was worried about her driving. So our occupational therapist, our driving expert, helped her. Our speech therapist helped her with her cognitive abilities so that she felt more secure when she was out socially. And all of this takes a while, but after a few months, she felt like she was pretty much back to the things that were really important to her. So that was exciting, to get that support and just address all those concerns for her. I think, some of the folks that came to our session, PTs and OTs globally, they don't have a united front. Maybe they're isolated in where they work, or the doc is isolated. They don't have somebody on their team. I think just finding resources in your town to support the whole patient in their sleep, their nutrition, their movement, their social activities, their psychological health, even if they're not physically on your team formally, but you can, make sure you find those resources in your town for the patient.